Very good afternoon to all the dignitaries. Thank you so much, sir, for the question and for the opportunity to come here and talk about this very important topic, that is digital quackery. The theme of the conference is serving patients in digital age. And one of the biggest problem or the significant concern that we have with the advent of the digital age is digital quackery. Some may say it as medical woo, some say it as Google Babas, as some of the sirs have said it over here. And with the influencers often disseminating unverified and potential harmful content, it is one of a very important concern that needs to be talked about right now. We all know that India is a country where every household has a doctor or a medicine expert. You have any problem and they would be the first person giving you any advice related to what should be taken, where to go, which doctor to even consult. And with the advent of many social media platforms, we see there is a rise in much of these unverified information going to the public and affecting the masses. And it also affects their healthcare seeking attitude. We have a lot of problems and a lot of examples, as we have shown. We talked about COVID, and we would have seen that there was a time when a medicine called azithromycin was very popular at the very first wave, and people were rushing to chemist shops and they were running to get azithromycin, thinking that this particular medicine will help them in not even having COVID. But we saw that it's just one of the very false news or fake news, as we say, that was spread during the COVID-19. We have studies also by Kingston University that said that most of these fake news, around 60% of them, are related to healthcare topics. And there can be various factors. There are various causes that were discussed by the dignitaries over here. But I personally believe one of them being the latent period that we have. The patients, they have a latent period in healthcare seeking attitude. Like they wait till the last moment, till the time things don't go out of the hands, and then they consult the doctors. And before that, they try to seek their comfort through all these quacks that are present. It also shows that there is kind of a lack of confidence towards the healthcare system. Maybe it could be because of not able to have a proper communication while the patient is there in the healthcare setting, and maybe their questions and their concerns are not being addressed in a proper manner, and that leads to again them to these healthcare quacks. Another important example can be the lack of awareness. That we say that there is access to information because of Google, now ChatGPT and AI models and all of that, but there is still a lack of access to the right information, which is right, what is there, which is there, and which is very concerning to the people. That is there is a lack for those kind of information, and people often fall prey of these informations which they found it very easy to implement, and then they go for that. There is a very beautiful Netflix series called The Apple Cider Vinegar, and there it portrays a true story of an Australian health influencer called Bella Gibson, who falsely claimed to have cured her brain cancer with alternative medicine. And then she forms a community around and teaching people all the steps that she took, and that she used to monetize it, and she used to take money that through her regimen, it will help them cure cancer. So there are a lot of such examples that are there, and we need to have some stronger policies. We need to have stronger steps to prevent such things. As a medical student and also as a future healthcare practitioner, I believe that there is a need to enhance digital literacy. We have a lot of information coming. We talked about clinical trials. We talked about researches and systemic reviews. There was a study that showed that more than 100 clinical trials, systemic reviews, and meta-analysis get published every day. What to understand, what to take out of them, and which to practice is always a challenge. And that's where comes the evidence-based medicine and having the concept of critical appraisal. There is also active online presence that just need to be there. We see all these influencers, they have a very good hold on the public and how they prepare the content. And through them, they are able to attract those things, or they are able to influence people who might be needing that particular, maybe a keyword or something like that. And through that, they are able to influence it. we had a very beautiful app during the COVID-19 called Arogya Setu, through which we were able to identify that there were like where are the COVID cases, where to find the vaccine and all that. We need to have such apps which are again popular among the masses. I hardly believe that any one of us will be having Arogya Setu app right now in our phone, or any such apps that is there by the government, which do provide proper information, but because it's not digitally appealing to us, we don't have that thought to even have it in our phones. So that is one of the important factor. And then again, to promote transparency, a lot of these influencers, they do kind of to monetize thing, like they are maybe sponsored by some of the companies to promote their promote their products. So there needs to be proper transparency that needs to be there to identify that whether what they're saying is completely trustable or not. And also we need to have regulatory bodies who regulate the kind of information that is being spread through those social media platforms. And another important factor is counseling. The patients finally come to the doctors, and I understand that India is a very big country, and we do have a problem catering to all the patients at heart. I come from an institute like Safdarjung Hospital, where there is a lot of many patients that come, and I can clearly see that there is a lack of counseling that is there. So if we understand this important concept of counseling and having a proper and beautiful doctor-patient relationship, I hope that we will be able to counter this problem. As I said, as Sir asked about medical students, I'd just like to show that we at the Medical Student Association of India have always tried to serve the population through our efficient network of over 22,000 medical students across India. And there we organize, we bring people, the medical students who are motivated and dedicated, and they lead a lot of these student-led initiatives and the capacity building sessions and advocacy programs and campaigns where they talk about important topics like communicable, non-communicable diseases, universal health coverage, sustainable development goals, human rights and protection, sexual and reproductive health, etc. And I believe that through that aspect, we are reaching the fact that we are able to reach to the grassroots and bring a change over there. And as it's a motto of the organization and something that's very close to us, making a difference together, I believe that all of us being present here, we can make a difference through this action, and including patients into it and having them as an important stakeholder. It's a very first step that we can bring up to have a proper and a healthcare system that is not falling prey of these digital quacks. Thank you.
Thanks.